Big deep breath again, Denise, and push again. Really hard. Really hard, Denise. You're doing it. You're doing it.
I guess one of the most exciting experiences that I have as an obstetrician is being able to witness a baby being born. I guess there's nothing just more exhilarating, there's nothing more privileged, I think, than witnessing, the start of a new life. And I think that it's the closest we ever come as human beings to creating anything, and to be a part of that, it's a real special experience.
What is a mission? What does it stand for? Does it mean something to employees, to the public? More than 30 years ago, Kettering Medical Center was built with a mission to meet the needs of the community. That is still its mission today. Kettering Medical Center is committed to improving the lives of the people of our communities through health care and education. We are dedicated to excellence and to providing each individual the most appropriate care in the most appropriate setting. In the spirit of Seventh-day Adventist healthcare ministry, we strive to be innovative and to convey God's love in a caring environment. During the next few minutes, you'll meet some members of the Kettering family who help carry forth the KMC mission, and you'll see that their commitment to the Seventh-day Adventist healthcare ministry is just as strong today as it was when KMC first opened its doors.
But I went into medicine truthfully because I wanted to help people. I wanted to do something positive, in this life that would make a difference in other people's lives.
As one of the newer members of the KMC family, I'm impressed with the dedication and caring I see in employees. Kettering Medical Center isn't just a building or a business, it is people. People like Dr. David Doucette and board member Samuel Chapman, who joined the Kettering family because they want to make a difference in the lives of others. It is people like KCMA student Amy Moeller, who came to Kettering for an education and also found a personal relationship with Jesus. It is about people like Mildred Kostenko and retired anesthesiologist Dr. Vernon Luthus, who more than 30 years ago were among the first to heed the call to help at the new Seventh-day Adventist hospital that was opening in Kettering, Ohio. The passion of the founders is what brought the mission of Kettering Medical Center to life, and we now have more than 3,000 employees who are caring for thousands, embracing our mission and making it live today here at KMC.
I guess we had followed the development of Kettering Hospital for 2 or 3 years, ever since it started, because it came out in our church papers about it. And about 3 or 4 months before the hospital opened, my husband received a call to come for an interview, which we did in December. So we accepted the challenge of breathing the breath of life into mortar and stone at Kettering Hospital.
30 years ago, Eugene Kettering envisioned that a hospital offering quality care in a caring environment would be a fitting legacy to his father, the world-famous inventor Charles F. Kettering. On March 3, 1964, Kettering Memorial Hospital opened to a fanfare that included dignitaries from all over the country and a keynote address given by Dr. Annis, president of the American Medical Association. It was a proud day for the Dayton community and Seventh-day Adventists.
We felt, those of us who came here initially, we felt definitely that this hospital was ordained by God to serve this community. And the mission of the hospital was just that, to serve this community in a Christian way by Christian physicians. I made it a habit of praying with practically all of my patients. And I think that pervaded many of the departments. I know nurses prayed for patients, and many departments started the day with a little worship and with prayer, because in ministering, they wanted to minister like Christ ministered, unequivocally, through pure love, to help somebody, whatever the need was.
From the board leadership and throughout the institution, the KMC family is committed to fulfilling the mission of the medical center. Although some of the words may have changed over the years, the vision remains the same: to offer physical, emotional, and spiritual healing to the Dayton community.
KMC have done a number of things to help meet the communities. Among them, of course, being the adolescent health program with the YMCA, and then there's the Good Neighbor House, which is a collaborative effort with the health community at KMC.
Our concern for others is evident throughout the medical center. The care that people find here doesn't just affect patients and visitors, it impacts all of us.
And KCMA provided the atmosphere for me to be able to focus. It provided the spiritual nourishment that I wanted so bad, but I never found at Ohio State or anywhere else I went. And I needed something to keep me anchored. And I kind of look at KCMA a little bit like that. I feel anchored.
The caring people Amy encountered at KCMA impacted her life in ways she never expected. She's involved in Bible study, and earlier this year, Amy was baptized.
The people at KCMA have greatly affected my life. I've seen God through so many people at Kettering. It's amazing. Nothing compares to a Christian atmosphere, and KCMA had that, and that's something that really helped me so much.
We can write a mission, talk about it, and hang it on the wall, but does it matter? Is the mission here when it really matters for the patient? Just this past April, Dr. William Persh and his wife had no thoughts of life-threatening illness and major surgery. They were looking forward to their daughter's upcoming wedding, but all that changed very quickly.
I came to in the cardiac intensive care ward. I heard this voice saying, you can't speak because you have a tube down your throat, but you can open your eyes if you want to. And finally, everything started to come into focus. And that began a very fine experience at Kettering Medical Center for me. The team here is absolutely incredible. I had patient care beyond what I felt was ordinary. I mean, this was exceptional.
The Kettering family is a team of caring individuals who are the backbone for the Kettering legacy of Christian service.
It doesn't matter whether you're Seventh-day Adventist, Catholic, or whatever. At KMC, Christians are Christians. We as Christians believe that there are certain things that happens through the healing process that include divine intervention, and we can see that.
You're 57 years old. You're facing the most major surgery of your life. You come in, and you have such a positive experience. It's incredible. You can't put a price tag on that. And how do you thank people for saving your life? Because that's what they did. And they turned it around. My surgeon told me that I might have as many as 25 more years left. I told him, you're young enough, I'm going to call you on the 25th anniversary and say hi and thanks. And of course you thank God because you've got this organization here that serves you. And my decision to tell my wife, get me to Kettering if anything ever happens, was probably the smartest thing I ever did.
I have great optimism about the Kettering Hospital because of the people that are here and the changes we've seen and the enthusiasm that I detect among workers here and among new physicians that have come, that they want to be a part of something that means something, not to them only personally, but to the relationship that they have with Jesus Christ and to the community that they're here serving.
As chairman of Kettering Adventist Healthcare and the Medical Center Board, I'm excited to see the passion for our mission that is so visible among the staff. The Seventh-day Adventist Healthcare Ministry shines brightly here, and thanks to the special people of KMC, the light grows brighter every day.
Here comes the baby.
Well, how about that?
So funny.
There you go. How about that?
I'm in a practice where every day I get up, I enjoy going to work. I enjoy going to work because the people I work with share the same kind of values that I share. They share a sense that we want to make a difference in people's life. I work at an institution, Kettering Medical Center, where, you know, from the very top, the emphasis is not just on, you know, figures and facts and dollars and cents and patients in the door and patients out the door, but it's people. It's really truly caring for the people that come through the doors, and that's exciting to me. There's still a specialness about Kettering Medical Center that mission can be fostered here, that it is fostered here, that there are people that believe in miracles here. There are people here at this institution that want to provide personalized care to their patients that goes beyond just the physical needs, but the spiritual and the emotional as well.